Hello. Uh, Good afternoon, everybody, and welcome to our first staff chat of 2022. Yeah, I'm saying that right. It's like a tongue twister. For those of you who have viewed one of these chats before, welcome back. If this is your first time, welcome. My name is Priscilla Andrews. I'm the clinical manager here at the Cancer Wellness Center. The staff chat series was created as a way to give the Cancer Wellness Center community insight into conversations between two professionals talking about concerns, issues, topics of interest to the cancer community. And I am very, very pleased today to have with me one of the newest additions to the Cancer Wellness Center's clinical team, Elissa Siegel. Elissa is our center's first and fabulous child life specialist. So thank you so much for being here with us today, Elissa.
Thank you so much for having me. Happy to be
Yeah,
here.
yeah. And I think I always, as people who um, have viewed these before, are probably familiar with. I'm always like to open it up first just by finding out, before we find out more specifically about what a child life specialist is, because I'm sure there are people in the audience that are not familiar with that role. Um, Curious to know what drew you to the field of working with kids, maybe more specifically if there's anything that drew you to working with the cancer community.
Sure. I first was introduced to the child life profession when my daughter was 3 years old and needed to go to the hospital. And I was introduced to this wonderful person who helped normalize and make the hospital room a little bit more familiar, introduced play to explain what was happening. My daughter needed an IV start, so she was great with distraction and working through with some coping strategies, and really made the whole experience so much more pleasant. So that's how I learned about what the role child life is. And traditionally, it's in a hospital setting when a child is in the hospital, or if the parent is hospitalized, child life comes in and helps with the kids in the family. And I just loved everything about what child life specialists do. And the biggest part of it is you use play and children's own love and joy and curiosity to help them understand what's going on with their family's healthcare crisis. And what drew me to the Cancer Wellness Center is just my knowledge of the center's existence through friends who have utilized the services. I've been to a couple events, and I knew that child life would be an excellent supplement to the terrific therapies that are already happening. So
And I think we've already found because you started in August, September.
I think late August, middle of September by the time I really started going.
I'm glad I wasn't too off. I would have felt horrible if you were like, Priscilla, I've been here since May. But I mean, I think I can say, your role here, it's like we got something that we didn't even know we knew we needed, because the demand for your services has really just exploded. I think we've kept you very busy, in other words.
Yeah, I'm thrilled to be of service, thrilled to be able to help. It's been terrific.
So, you shared a little bit about this in your introduction about the role of the child life specialist. And I think just noting the sort of uniqueness of it being a growth edge, even in the field, to be in the non-hospital setting. For those people who don't know what a child life specialist is, or maybe don't know what a child life specialist role could be through the Cancer Wellness Center, help them understand what that role is.
Sure. So basically, my role is to help provide that resilience that children need when faced with something that might be anxiety producing, brings them worries. So I help find coping strategies, anti-anxiety strategies, anything to reduce any kind of trauma regarding the whole cancer diagnosis. And I use age appropriate language to help explain what's going on, to help the kids verbalize their wonders and their worries about what's going on. Because lots of times parents will ask, do you have any questions? And that's a really difficult idea for a child who has no context to what cancer is. So
And to say that's hard for adults to even generate those questions sometimes.
Sure. And that's where I can come in and help with language choice, to help simplify things, to help break it down into a way that we're going to give the tools to your child to learn how to be resilient and get through this with your help, with my help, with the center's help. I'm here for support.
I mean, it seems like child life specialist really takes a strength-based approach when approaching kids. And I hear a lot of what you're talking about is distinguishing between the idea of something being, and maybe I'm going to say this the reverse way, but like something being a trauma versus it being experienced traumatically, right? I mean, it seems like the idea of like kids, just because cancer can be a trauma, doesn't mean that it has to be traumatizing.
Correct. That's exactly right. And one of the best ways that I can help introduce these big topics, and I don't know if you can see behind me, but my room is basically a big playroom. And that's kids' first language is play. It's how they learn, it's how they master concepts. And I apply that when we are working through big feelings, big emotions, just getting down to their level and working with them and the family in language that they understand to help them move through the steps of becoming calm and being able to live in a household that might be a little chaotic, a little less structured than they're normally used to. I'm here to build that up.
It almost sounds like, as you were talking, it's almost like you're like a Google translator for kids and parents, right? That like that idea of how to speak to kids in their language and help them communicate maybe to their parents more effectively.
Sure.
When their parents may be speaking a different language when it comes to cancer.
Sure. And, there's so many similarities to what children really are asking. And it's easy to kind of get lost in the weeds of a diagnosis and a treatment plan. But really, what children need to know is stability, my environment. What's it going to look like at home? Younger children, who's putting me to bed at night? How do I still talk to mom or dad if they're in the hospital? As you have older kids, you'd be surprised those environmental questions are still just as important. So it's about really figuring out how to best address what's worrying and wondering with the kiddos and putting everyone on the same page.
It's something that is occurring to me, thinking about putting everybody on the same page, and thinking about also the challenge of parents, adults projecting onto their kids how they may respond or what meaning they're going to take away from a cancer diagnosis. And I think, or even hearing the word cancer. And I think one of the things that I encounter quite frequently is parents being reluctant to disclose or talk about the cancer diagnosis with their kids, or feeling very lost about how to talk about it with their kids, even to just tell them that they have a cancer. So I mean, like how to get on the same page
Yeah.
at when you're not even talking to the kids. And so when you have that parent that comes to you, because I think in addition to working with the kids, you also do parent consultations here.
Mhm.
You know, when you have a parent that comes to you wondering about, should I tell my kids? How do I tell my kids? What guidance do you typically provide?
Sure. And that's one of the biggest questions is how do I tell my son, my daughter that I have cancer? And I always advocate for transparency and honesty at the very beginning. When you say the word cancer, an adult's going to take their experiences, their knowledge, and put some really scary emotions attached to that word. Most kids don't have that, and cancer's just a name for what is happening. When you say, I'm sick, that kind of triggers a different kind of response because kids get sick all the time. And sometimes they're sick and they don't even stop what they're doing because it's a runny nose and you have a runny nose and we still go on.
Yeah.
So
Which can I say, I would imagine if you say I'm sick, how confusing it then is to see mom not be able to help around the house and play, or dad not going to work. Like that would completely freak me out because I have my expectations all set up about what sick means.
Correct. And it also now adds a level of trust and mistrust because your kids, all they want to know is that you will give them correct information so that they can move on. If they know that this is the cancer, you don't even have to, in many times, describe what kind of cancer. Sometimes just, this is what I have. I'm going to the doctor. We're getting the treatment that I need to be well. You sometimes don't need to even go any further than that. But what I always express is that you can't take back what you said and say, okay, well, actually, I wasn't sick. It's a little bit more than sick. It takes away some of that basic trust that we all need in our lives to be able to move on to the next step. So I always say, use the word, take the fear and the ambiguity away, and just say it. I have cancer. This is what I'm going to do next. I'm going to the doctor. Here is my next step.
It's simple. It's like the like rudimentary how to write a paragraph.
Yeah.
How to write a story.
Yeah. And a lot of times that's just enough information for the kids to say, okay, all right, I've got that. Now, older kids, you think, well, wait, they're going to want to know so much more. And that may or may not be the case. A lot of times older kids will take what you say and then they're going to go ahead and do their own research. They're going to get on the internet. They're going to figure out what's going on. And then that's when you come back in and say, right, you know that you've read about what I have. Let's talk about it. And that's when I can help decipher some of that language and explain it plainer. Or even more than that, what are you wondering about? What are you worrying about?
Like draw those questions out, help them articulate those questions so they can have the conversation with mom or dad.
Yes.
Now, can I back up a second? Because I'm curious. I have to imagine that you have encountered those parents that in the immediacy of the crisis, they have just said to their kids, well, I'm sick and I'm going to go to the doctor and everything's going to be fine, or whatever they say.
Mm-hmm.
And now they're coming to you. Is there guidance that you provide to help sort of heal that rupture that may be there as they're coming back and giving that added layer of detail?
Sure. And I would plainly say, I went to the doctor because I was sick. Now I have more information and I'm ready to talk to you about it. You certainly don't have to go back and say, well, I'm a little more sick than I thought I was, or that I said I was. You're always allowed to say, now I have more information to give. And that kind of takes you to the next step of becoming a little bit more specific with what's going on without taking away, yeah, what I said wasn't really true. No, now I have more information. Now I have the words to explain to you what's happening. And I will also just interject, and I know you didn't ask the question, but a lot of times I get parents who say, I don't want to cry in front of my child. I think that scare my child. And actually, I would say it's the opposite. It gives permission for those feelings to be freely shown. It's permissible. And you model that, yes, we cry. It's sad. It's scary. I'm upset. I cry. And then I move on. It's okay to cry. But look, I can cry and I can still be happy too. I can feel both things and still be okay. And that protectiveness of I don't want my child to see me cry for X, Y, and Z. I say, oh no, flip it around. You want them to see you cry because it normalizes it. It's not something you have to do alone by yourself. Plus you want a hug and they want a hug. And it just sort of opens up the permissiveness of feeling scared and getting that support from each other. Which is
and the idea, and the idea that like it doesn't have to be scary to cry, or it doesn't have to be scary if you see mom or dad cry, because I know that they're going to stop crying. Like that it sort of takes a layer away. Because I always say like there's the emotion and then there's the emotion we have about the emotion.
Right.
So we can't, the emotion's there because that's natural, but can we do something so we don't have to have these really strong feelings about the feelings that we're having?
Yeah, just allow it. Just allow it, especially if your family love language is emotional and hugging and touching. And even if it's not, you model for your children the healthy way of expressing emotions, especially at a time where it's a little uncertain. When parents show their emotions, kids get cued in that, oh, it's okay, I can show my emotion too.
Yeah. And I want to come back to something else that that you said there, that just it brought something up for me, which is, you know, the idea that kids may want minimal information. Kids may be satisfied with kind of broad stroke information. I think the other thing is like, and you didn't say this, but something that I've, you know, witnessed is, you know, the kids sort of touch it and then they're off and they're playing. And something that I encounter both with small children, but I think especially with adolescents, is that parents then can sometimes go into this realm of they don't care or they're hiding something from me. And I wonder how you respond if a parent has this knee-jerk reaction in either end of the spectrum of like, why don't they care more, or why are they not talking to me, why are they not having XYZ feeling, they must be suppressing it.
Sure. And that's typical of an older child in their teens, even older school aged, I would say maybe that middle school, 6th, 7th, 8th through even in college. And I would say that it's really hard to separate what typical adolescent teenage behavior, which is separation from parents, relying more on peers for support, relying more on peers for their socialness, and they do detach from the parents. So I would sort of respond like, let's not confuse that they're not coming to you with questions, that they're shutting you out. They're actually developing the way a healthy child should be developing. And that's actually something that you should be proud of, that you have given them the foundation that they can go ahead and have that normal development and that normal attachment to peers. When it's the other way, where they're constantly asking you and wanting to get information, that's actually the wrong direction. You want them to be able to separate a little bit. Now, if you see it going to the extreme where they're not coming down for dinner, and dinner is a family time where you're always together, that's a different story. But just separating a little bit and not constantly telling you how they feel, that's typical and normal and healthy.
Yeah. And I mean, my impression, and I should say, I don't work with kids, so this is educational for me just as much as the people in our listening audience, that really we want to support our children in hitting those milestones and doing those things that are developmentally appropriate, that's part of fostering that resiliency. And sometimes those things may mean, especially for teens, they're not drawing close, they're not being overly attentive, they're worried about how is this going to impact cheer practice, and am I going to get to still be in the school play, and all of those other things that would be normal for a teenager to be doing.
Right. And you know what? The other part of it is they have to leave their house and go to school and do all their normal things. And they need to take whatever emotion is happening in the home and store it right back here. Because in front, they have to take their math test and they have to make sure that they've taken their notes for science. And that's healthy to compartmentalize. That's okay. They don't always need to have their emotion right in front of them and something that they focus on so they can get through the day. That's something that parents and adults do for their kids sometimes. Like if they're feeling sad about their own diagnosis and then you're feeling sad that your kid isn't showing you the sadness, you've got all the sadness. That's okay. Let the kids go ahead and have their day at school and have their time. And it's all right to ask them, hey, are you doing okay? I'm a little sad. How are you feeling? Check-ins are perfectly fine. Yeah. It's the constant, are you okay? Do you want to talk about this? That's when it can sort of feel a little invasive.
And how does this, we've been talking a bit more about teens. What about for the grade school kiddos, as far as like normal development and, things that parents may worry about, but are actually normal?
Well,
or I hate to use the word normal, but like developmentally appropriate. How about that? That's a fancy term.
So, obviously each child is different, just like each teenager is different. And I would say that most younger kids are going to have those feelings come out while they're at school, right? And they're going to feel sadness, especially if they know that mom has a doctor's appointment today. It might be too much for them to hold on to what the normal day should bring because they are feeling nervous and scared. And that's when those coping strategies really come into play. That's when we talk about how can we self-soothe, how can we regulate our emotion. We talk a lot about breathing and mindfulness activities that kids, even at 5 and 6, can do for themselves to help them through an emotional moment. That's when they're not with you. When they're with you, absolutely, those check-ins can happen in the morning. It can happen when they come home from school and when they go to bed. I would say take the temperature of your child. What do they need right now? If they are feeling kind of out of control, when they have all these big worries, that's when I'm very good at giving additional support to help those children figure out what to do with those worries. But if you are checking in and they're like, well, I'm sad. I know you're not going to be home when I get home from school today. You're right. I'm sad too. That's exactly right. I wish I was here. I'm not, but guess who? We have your favorite babysitter. We have grandma and grandpa are going to be here. As long as they have the information, that's like half the battle for them to be able to move through that moment of sadness and get on to being a kid. It's when
And
they cannot recover from that feeling of sadness. That's
what you're looking out for. And I think you sort of started answering this question, which is like after the kids have been told,
Mhm.
after the treatment plan is in place. I mean, I feel like the next question is for parents is like, well, what do I need to have in place for my kids to help them cope with this experience, cope
Sure.
with the cancer?
Sure. And, it all boils down to that level of transparency and that honesty and that, being, here's the information I'm going to tell you as soon as I know. So I would suggest, that always happens. With treatment that's going to physically change your appearance or drastically change your energy level, those are the conversations that have to happen before it happens, right? So that your child,
Like, don't wait.
right? Because they need, again, it's all about that predictability. It's all about my environment is exactly what I expect it to be. So I would bring your child in to the level of your comfortability about what's going to happen next. And for older kids, we might want to take stock using like journaling. You have a lot of big stuff happening. Let's get you a place where you can have some emotional, expressive activities to help take what you're feeling and take it out of your body and on a piece of paper. Or let's make sure that we have a set time just to talk. And even if it's just while I'm lying on the couch, we have 10 minutes at the end of the day just for a check-in. For younger kids, I would probably introduce more concrete coping strategies. I work a lot with something called a worry monster, where we write down our worries and we feed them to our monster, and that helps identify what's going on, but giving it to something else to hold on to.
Yeah.
I do a lot of art expressive activities that are meant to facilitate emotional expression and get into, well, what are we worried about? Lots of times it then is, well, what does it feel like? What is going on with my parents? I had one little friend tell me she wanted to be on both sides of the story. She knew what it was like to be home when dad was in the hospital. She wanted to know what it was like for dad when dad was in the hospital, but wasn't sure how to bring it up. Well, you know what? That's not a kid thing. That's an adult thing. So when you do have an experience, it's okay to ask, do you want to hear what it was like? And then let's talk about developmentally appropriate things to talk about. Well, here's the bed I was in. You know what? There were 5 buttons. My bed goes up, my bed goes down, and I have a nurse's button. And that's what what the hospital experience was like. If it's a little bit of an older kid, you can even get into, well, I had some medicine. They brought it in through an IV. I didn't take it orally. My body drank it in. I had lots of doctors come in and check me. I had some tests to see how it was going. Those kinds of informative pictures of what was happening when you weren't physically with them is so comforting to those kids. They have a picture of what was going on, and it satisfies them.
Yeah.
That is, so again, it's that information, keeping the level of information current and open to asking questions and asking about worries.
And it also seems like that goes alongside of like, what can we do to create a stable environment for our kids, are consistent.
Sure.
And if we can't, can we help our kids with expectations so they know what to expect?
Yeah, one of the hardest things is when there's an extended stay in the hospital, especially for the younger kids, because your bedtime routine is interrupted because mom is no longer able to do everything mom was going to be able to do if dad's in the hospital, or vice versa. So I like to prep those kids. Let's talk about steps to stay connected to the parent that's in the hospital, whether it's let's send a book so we can read the book as a bedtime routine. Let's bring cards. Let's try to come up with ways that the child can have some ownership and investment into the connection that no longer is in the same house, but virtually.
Yeah.
Also empowers that child. She has some choices. I get to stay connected to dad. Well, what do I want to do? Do I want to write dad a card, a get well card? Or do I want to send him a stuffed animal of mine so he doesn't, miss me? Yeah. Those kinds of choices that we can give back to those kids are so meaningful, because so much of what's going on in their lives, they have no choice. They have no control over.
And it seems like, I think something that I was already aware of, but I think that this is really driving home for me, is that resource role that you can play for families and for kids. If a parent, you're just streaming off all these wonderful ideas, and I'm like, Jesus, this sounds really good. I should write that. But like that, if a family is struggling to figure out how to come up with those ideas, or how to have that conversation for the kid to elicit what they need, that's really where you can step in to sort of create that bridge. So the family has tools, the kid has tools. I mean, you're kind of helping the kids, but it seems like really you're also helping the parents know, oh, okay, this is what my kid needs from me right now.
Exactly.
Now, something we haven't touched on yet is, we've been talking a lot about the context of a parent having cancer. And I want to say, like, while that is something that you see here, you're also able to see kids who have a grandparent or extended family member with cancer. Maybe they have a sibling with cancer. Maybe they themselves have cancer. I'm curious if you could speak to how either I guess it's a two-part question, because it's two totally different questions. Does your role differ at all if it's not a parent that is the one with the cancer?
So that's a great question. And the short answer is no, because you're still dealing with the child at the age that they're in, developmentally appropriate language and activities to help them understand what's going on with the cancer diagnosis in their family. So the difference sometimes is if it's an extended family member who doesn't typically live in the home, but because of treatment, because of end of life care, is now in the home, that takes on a little bit different flavor than if it's mom or dad going through treatment, because we've introduced not only a brand new person, but a brand new person in a way that they've never really interacted with that person before, especially if they're coming in for that hospice palliative care. So that does change my approach a little bit. Siblings, there's definitely a different flavor to when I'm dealing with siblings who are coming in, because they have their own set of issues that they're working through, between the feelings of being angry that they're being left out, to guilt that they're healthy, to taking on more adult responsibilities because they're trying to help out in the house. So that's a little bit different than what I would normally do with just a child whose parent has cancer. Yeah. And then with the pediatric patient themselves, yes, that is a completely different animal, because now I'm going through, okay, let's talk about what happened. Do you remember when you were diagnosed? What was that like for you? Tell me about when you were in the hospital. Sometimes, especially when you're in the moment and you're sick, you can be told what was going on. Most likely they've seen child life in the hospital. Most hospitals have excellent child life departments, and it all is very good at the moment. But then when you come home and you've sort of stepped back from the patient in treatment role, and now you're at home, then you're trying to just get back to normal life, you still need to sort of process what's happened with you. And that's when I come in and I start doing medical play with like syringes and gauze, and we try and take an IV tubing, and we try and take some of those medical pieces and use them in a different way to help express emotion, to get through what they've experienced. Some of it was painful. Well, let's work through that with a syringe, not with the needle, but with the syringe.
Yeah.
So it is a little bit different, but it's all about coping and reducing anxiety and any kind of psychosocial trauma that they went through. It's all about, like I said, back to the resilience, so that next time any of these kiddos are in a situation, they have tools to draw upon to help them through.
And a sense of mastery.
Absolutely.
Right. The goal is the same regardless of the relationship or the relative position to the diagnosis. It's just the path that you might take or the pit stops you might make are going to be a little bit different.
That's exactly right.
So we have a few minutes here. I want to ask this question. It's a big question, but
Okay.
maybe you can give me the 10,000 foot view of it, because I think, you know, we get parents, they call and they think their kid needs therapy and they see this behavior and they're worried about it. And, you know, the first stop we're going to make, right? They're going to call this center, they're going to talk to Katie Holler and take coordinator. And she's going to say, well, why don't you talk to our child life specialist?
Yeah.
And I wonder how you differentiate between kids that need coping strategies and are on their way to normal, no, not normal, developmentally appropriate. They need a little support and they're going to move down the road, versus kids that may need a higher level of support.
Sure. So, you know, I will say that I've encountered that a couple of times where it's after I've met and built a little rapport up with the kids and did a little of my own assessment, even though I've spoke at length to the parents about goals and all of that. Once I sit down with the kid, I can get to some pretty pointed questions and draw out what is going on. And kids are pretty honest about what is happening. And if it's not the cancer diagnosis, they'll tell me. They'll tell me right away, oh, Mom and Dad have told me we've got the doctors, they are on it, the cancer is being treated. That's, you know, I'm really glad to hear that. But I'm worried about X, Y, and Z. And it just happened to be that cancer was just a little small piece of what they were worried about, but not the big piece. So then that's great that they could tell me, and if I can give them a little coping strategy for that little slice that I can, great. But after that, I'm going to go back and refer them to some outside support, which will be a more global approach to what's happening. I'm happy to reassess at any time, but I can tell pretty much after I've met with the kiddo the first 30 or 40 minutes if there's benefits to my services.
Yeah. Well, and it seems to highlight the idea that, like, you know, I kind of come back to something I said earlier, which is as adults, we can project onto the kid, well, they're saying they're anxious about school, but they're really anxious about this because this is the thing that's anxiety provoking. But
right.
They're going to do a pretty good job of letting us know whether that's true or not. Because sometimes it's not. And it sounds like when it's beyond the cancer or in addition to the cancer, that's where you would say this is somebody who's going to benefit. Although it sounds like that's not the majority. The majority of kids that come across your desk, so to speak, are really going to benefit from that, resiliency training, if you will.
Yeah. And sometimes that takes 1 or 2 sessions. Some kids I've seen 6 or 7 times. It sort of depends on the arc of the treatment program and what's happening in the house. But for those who I know really will benefit from other therapies that aren't cancer related. And I'll just say really quickly, I also am very confident in saying, yeah, you need some coping strategies, but you also need some therapy, because child life I'm not a child therapist. That's not my role. I have a pretty strict lane and I stay in it. So I've referred back out within our center for child therapists to come in and take a look. And then vice versa, where I've had the therapist say, oh, I think we need some child life. And then if you need me, come on back. But so we go back and forth. We have a great team here. So, yeah.
So I'm looking at the time. It's never enough time. It's never enough time. How can people find you?
So you said it best. You need to go ahead and just contact our intake coordinator, the great Katie Hull, who will take in all your information. And once she, assesses there's children in the home and there are needs for child life support, she'll go ahead and send me your information. I'm always going to start with a parent consult because that's most important to me, that I understand your values, your family's culture. I want to be gentle and use the language you're comfortable with before I see a child. Right now, I see kids in person. We're masked, but I have seen kids on Zoom, and it's fine. In person is better always for kids. But yeah, that's how you got a hold of me.
And I know that in addition to the child life work that you do, you also help plan some programming, and I think I heard there's a program coming up next month.
Yeah, we're going to do self-care at the CWC, where we're going to have therapy dogs come in.
That's fun.
Are so
I want to come to that. Man.
Yeah. Well, yeah. So this event is actually for caregivers and kids alike. The last 2 events I had were mainly just for the kids. The last one was like a drop-off event. This is for caregivers and kids. So you'll have 45 minutes with the therapy dogs, and then the kids are going to separate from the parents, and we're going to do some mindful yoga poses for some self-care. We'll work with me. We'll have hot chocolate. And what's great is then the parents have a chance to meet each other, because right now with COVID, it's so isolating. You don't know anyone else who's in the same situation you're in. But I know you all, and I know that when you have a chance to connect, good things happen. So it'll be for both parent or caregiver and kids this time.
What was the date again?
February 21st. I think it'll be up on our calendar soon, and then there'll be a link to register. Space will be limited, but it's open to the children and the caregivers as well.
Wonderful. Elissa, thank you for being here. Wealth of information. I appreciate your time here today.
Thanks, Priscilla. It was great talking with you.
And thank you everybody who was here on Zoom, who maybe was watching on Facebook Live, or maybe watching this on our YouTube channel. I will be back here in the coming months, so please, with other speakers, so please stay tuned. Check out our calendar at cancerwellness.org, and I look forward to speaking with more people in the future. Thanks a lot, Elissa. It was great to see you.